From the kitchen to the corners of the earth, little glass jars work to stop the hurt. Study overtime, getting everything right. She left the pharmacy and came to holistic life. If Mother Nature didn't make it, then you don't have no business trying to take it. If Mother Nature didn't make it, then you don't have no business trying to fake it. Now see our natural herbs have your energy and flow. A splash a dash a throw. If you know, then you know. She make the best medicine from your head to your toe. From the root of the tree to your soul, so you grow. One spoon said to what the stress done start. Steam on the stove, peace in your heart. From Kingston rain to London snow. Same strong roots make your spirit grow. If Mother Nature didn't make it, then you don't have no business trying to take it. If Mother Nature didn't make it, then you don't have no business trying to fake it. Now see your natural herbs have your energy afloat. A splash a dash a throw. If you know, then you know. She make a
Alrighty, a very good evening to all of you, my friends, family, well wishers, my good buddies, everyone who is tuned into Channel 2. And by the way, I need to mention to Channel 2 that I've received complaints that the persons who normally would get Channel 2 are not seeing Channel 2 at least for a few weeks. I don't know. I know there's renovation that's happening, right? But I know also that the television station is still working. So whatever it is that needs to be tuned up or turned up or fine-tuned to get the viewers to be able to see clearly what we do, please do it, because some of them are hearing and they're seeing, some are seeing and they're hearing, and some ain't seen at all. So please make the adjustments, okay? And those who are streaming, you can tune in to Safe TV Channel 2 on YouTube. Safe TV Channel 2 on YouTube. And, well, let me see. Well, he sent me the YouTube link. But this link, I can't put it on there. Maybe you could put it on the screen. Please put the link on the screen so that persons can see what they need to do to get us on YouTube when they're streaming. Please do that for me. Because what I have to show them to do, it's too much. And I don't know I really don't know who's tuning in. But if you go to Safe TV Channel 2, or who is trying to stream, and you put in Dr. Joseph Haynes on there today at this time, you should be able to find the link. And when you tune in, when you connect, then you could just hit the subscribe button and the like and subscribe. And every Thursday, you're going to be given a notice when it's time for you to tune in. You can do that, okay? I know we're growing and we're growing slowly, but that's fine. I don't have a problem with that because we have an audience of viewers on television. I'm not trying to get any points on YouTube or any views on YouTube, but eventually you'll get there, right? I'm not a YouTuber, but many persons don't have television anymore, and they're not able to tune into the channels anymore. So they look at what they need to look at on YouTube or Facebook or Instagram or something like that. But you could find us on YouTube, and just put in Dr. Joseph Haynes on there, and it will come right up. And for those of you who would like to call in on the program, you can call in. You can dial the 231-6477 number that is on the screen, And you can call and I will address your issue, whatever it is, as much as I can. I will address it for you and answer your questions to save you some consultation fees and maybe a visit to the clinic. And if you feel shy and you don't want to call in because somebody might know your voice, they don't have your problem, so they're not going to help you to fix it. We are willing to help you to try to at least get some ideas as to what to do to assist you with your condition. And, you know, I'm here to help, okay? Now, something I wanted to tell you before we start. The line is going to be open, and you can call and I'll take a pause and answer your questions. And as much as I can, I'll do my best for you, okay? Now, I was asked I was asked to speak today on men's health, okay? Men's health. And I'm willing to do that. But a question was asked today by someone of a particular issue that we were discussing, and it has to do with fibroids, okay? And the question was asked, does men also get fibroids? Well, the answer is yes. It is yes. It may be called a different name, like leiomyoma or something like that, or a benign tumor, but it's a fibroid, but it's not a uterine fibroid because men don't have uterus. Some men wish they did. Some people who wear pants wish they did. Let me say that. Some people who have male genders maybe wish that they had a uterus, but it doesn't happen like that. You don't have the body parts. If you're thinking about, being an experimental person, um, it is almost impossible for you to be able to conceive as a man trying to be another gender, a woman, right? It is almost totally impossible. I don't want to say because everything has a little possibility in it, but it is it is almost totally impossible for you to be able to bring a child into the world as a man or as a gender with man body parts, penis and so, okay? Because you don't have the body parts. And even if they want to experiment with you, they'll have to find a uterus to put inside of you. They'll have to find fallopian tube. They have to connect a lot of dots. And before the dots are connected, you're gonna die because you really, and then if you succeed in that process, because they'll have to cut out your penis and make it like a vagina and all of that sort of thing, and it's you'll be dead before that surgery is completed. I am quite sure about that, right? And then if you don't die before the surgery is completed, um, you, a man who is uh, really born to be a man, will not be able to, in my opinion, will not be able to have a child, you know, go through the time that it takes and then have a child. Because let me tell you, women should be really respected. Uh, they should really respect a woman because of what they go through. Women go through an enormous amount of discomfort and pain and uh, all sorts of things. And man can't handle that. Man really can't handle it. I can't see men can't even handle a little pain that they get sometimes. When a man can't urinate, when he finds himself unable to urinate, he can't bear that pain, much as the pain of delivery, you know? Can't handle that. So don't even think about it, man. You're not going to be able to make it. You wouldn't. You're going to die before you're able to get. God designed woman to be the only, or female. God designed the female to be the bearer of children, not men. Men can't even bear a little stress, much as what it takes to have a baby and deliver a baby and all that. So men forget it, right? But you do get fibroids, but you don't get uterine fibroids. You get it's basically a tumor that occurs in the lower abdominal cavity, and sometimes it may occur in your pelvic region, in your testicle and so on, or scrotum, in the scrotum, not in the testicle, in the scrotum. But it is not considered a uterine fibroid because you don't got no uterus, but it's a fibroid or a benign tumor that, in most cases, has to be surgically removed, and that's the end of that story. Okay. However, one day we're going to talk about female uterine fibroids or uterine fibroids in females, and what needs to happen to be able to deal with that, because it can create a lot of issues, and many women have fibroids and they don't know what to do, and they don't want to get they don't want to have surgical procedures done and all sorts of things. But we've been successful in helping to eliminate many fibroids up to a certain size. But once they get past a certain size, it's very difficult for us to navigate and try to get that to be shrunk and all that. But the factor that you want to consider, male and female, the man not having uterine fibroid but benign tumor, one of the things that you need to consider if it happens to you is to reduce your intake of estrogen foods that produce estrogen. One of the biggest culprits that helps to produce the estrogen is the chicken, man. The chicken. You know why the chicken? Because many chickens are fed with hormones. They feed them hormones. And the hormones are responsible. They are responsible for your production, right, of estrogen in your body, and then this fibroid feeds on that. Seriously, okay? Now, not all chicken are fed estrogen foods, but most chickens are fed with estrogen content foods. Why? Because they want to make them grow faster. Okay? So when you eat the chicken from most places, you're eating chemical estrogen, which continues to work inside of your body because you absorb it, unless you get diarrhea right after you eat the chicken. You absorb that chemical into your system, and it interferes with your hormones. And if it's estrogen, then chances are your fibroid will get bigger. And if a man has a tumor that has anything to do with the hormonal side of his body system, then if he uses too much chicken, then he will absorb or get estrogen in his system, and then he will have a problem. He will get a fibroid or a tumor at some point. Okay, tumors are really um, they're really benign. Most of them, the fibroid or the fibroid type tumors, they are mostly benign, but not all tumors are benign. There are many tumors which are malignant and can create serious issues. Okay, so I just wanted to mention that since we're on the topic of fibroids, we'll deal with that another time. But men, don't even think about it. You will get a tumor. It is a fibroid, but not a uterine fibroid. And if you need to stop eating so much chicken because if you get one of those tumors, then when you eat the chicken and you eat it with estrogen, if it has inside, um, you're gonna have a problem. Okay. Now, men's health. The problem with men is that we we just believe that everything is something simple. Okay, I see my operator sending me the the YouTube link, but um, it's hard for me to give him all this information. Put it on the screen, man. Well, if they put it on the screen, then those who are looking will have to forward it to those who are not. But it's difficult for me to give all this information. Just give me Safe TV Channel 2 or Dr. Joseph Haynes, um, you know, and then soon enough we're going to be on Facebook, okay? Soon enough, right? Soon enough we'll be on Facebook. But for right now, just put in my name or find Safe TV Channel 2 Georgetown. When you see that and you find that, put Dr. Joseph Haynes in, and you'll be guided to the program, right? It's a very interesting program, and you really should look and learn and pass on to your friends, like it, save it, pass it on to your friends and family and so on, because we talk a lot of good stuff here, and we genuine and we ordinary, we're not complicated. Anyhow, back to men's health. Men have this way of overlooking symptoms that they should not overlook. Okay, maybe I should use the word underlook. Men have symptoms that they overlook that they should underlook, if I can say that. In other words, they should listen to the symptoms and act upon them, right? I am quite sure that the average man who owns a car, I'm using a car because I don't know much about motorcycles. I never liked them, and I don't like them, and I dislike them even more because the people who ride them, most of them, they manipulate the exhaust system, make it noisy, and disturbs the peace. Okay, and I don't like that because it is wrong. Right? It's not right. It is wrong because your motorcycle should not be disturbing the peace, and it happens a lot where I live, and it happens a lot in Guyana, and it happens in many other parts. I hear that in many parts. But in some parts, you can't take that risk because the police is going to pull you over. They're going to seize your motorcycle, or you're going to have to go fix it, or they'll take away your license, or maybe your plates, or give you a ticket. In many countries, you can't make that noise and disturb the peace. But in Guyana, it's okay to do it because there's no really the laws here when it comes to traffic and violations, traffic violations, except tickets, do something about that now. But I wish they would do something about the tickets and about the windows that are tinted, dark tint. But they need to do something about the noise nuisance. Okay, and you need to put speed bumps on most inner roads because people are using the roads as a thoroughfare and they're racing up and down. I'm tired complaining and I'm tired mentioning this, but it is very disturbing. And I just saw one of my patients yesterday who live not far from here, and believe it or not, they're so fed up and disgust with the noise and what happens around here with noise, not only from motorcycles, but from people's little businesses, the little shops and the gamblers who play cards and dominoes and drinks and all that stuff. They're preparing to sell their property, and I'm trying to discourage them not to do it. But they're so fed up that they say they're going to sell the property and move from here, because they can't take the noise. Right? I don't know who else to talk to about this noise, but I spoke with enough people who should take steps um, to do the noise, right? Anyhow, I got a notice. You're not talking about men's health. That's part of men's health, right? Because if the noise disturbs me, I'm a man, and I'm quite sure it disturbs many men, and it could make things happen to you mentally. So that's part of men's health too. Anyhow, that's funny. Men need to take symptoms more serious. Men's health doesn't only include sexual health. Men's health includes everything that can go wrong with a man, including his headaches, his heart aches or belly aches or chest aches or back ache, uh, prostate problems, high blood pressure, diabetes. Men's health is it's comprehensive. It's more than just as general. So when you want to talk about men's health, we probably want to talk about man's habit in dealing with their health. The way men deal with their health issues, because we men, not I don't do that though, but we men have a way of contributing to our diseases. And if you think of the word disease or disease, it's dis-ease, right? If you know to spell, it's D-I-S, and you could pause there, E-A-S-E, right? Dis-ease. And anything that is diseased causes dis-ease. In other words, it will cause you to feel discomfort. You will not be comfortable. You'll be agonized. You wouldn't be the same. Okay. So it is important that you, like I was using the reference with the vehicle. When the light comes on your dashboard, men, women too could take note of this. When the light comes on in your dashboard, don't stop the vehicle and pull the fuse out. Okay? Some of you do that. The light coming on in the dashboard is like a symptom that you get a chest pain, a headache, a fever, a cough, right? Even some sneezing, okay? A swelling in your legs. That's like a light on your dashboard, okay? Now, if you want to do comparative analysis here, and you want to compare the act of a light on your dashboard to a pain in your chest, right? You may stop the car and pull the fuse out to get the light to go off, but it's not going to fix the reason why it came on. It's not going to fix it. It wouldn't. You see? So don't ignore the light, or don't ignore the symptom, because your chest pain could be your heart or your stomach or your lung, because it's all in the chest cavity, right? The stomach is a little lower, but it's part of the chest also. It could be an organ that is sending you a signal that you need to pay attention to. Okay, and I'm dealing with this men's health thing is not going to be one time. I can't do this today alone and finish. There's too many things. But you need to stop what you're doing and try to listen to your body. Try to analyze it yourself. If you have any idea about being analytical, try and analyze it and start thinking. Did I eat something that I shouldn't have had today, this morning, this afternoon? Did I have some pepper, or did I not eat, and I'm having some acid buildup? Because men have a way of even women too, some women have a way of blaming a discomfort in your chest as some gas. I always hear them say that. Oh, doc, man, it's some gas, man. I ain't had too much food today, so I ain't drink no hot tea this morning, which you shouldn't drink anyway, right? So it's a little gas. Well, it is okay to assume that it's a little gas, and it might be acid formation from something you had that was not broken down properly and digested properly and fermented in your system, right? It would only ferment in your stomach, not in your lungs or your chest or your heart. It would ferment in the stomach, and then it could create acidity, which would start some type of a bloating situation or gaseous situation. And you may pass some gas and get some relief because it might be that. But if you didn't pass no gas and get any relief, then you need to start thinking again. Is it something to do with my heart or my lung? You take some deep breaths and see if you get any resistance. Or if you really can't go deep, then you may want to think, because sometimes when you go deep, through your nose, not through your mouth. Sometimes when you go deep through your nose, you get a little sticking or shocking, like in your chest, because you're now setting air and maybe inflating the condition a little more. If you do that and you feel a pain or a sensation in there that is not very comfortable, you need to seek help. You need to get some help, because it might just be your heart. Okay. If it's your stomach, when you pull in, it shouldn't give you that sticking sensation, because the stomach is not the heart. Stomach is not the lung. Sometimes when you inhale deeply into your lungs, you may create a sensation that causes the lung to expand, and then it may press against the heart, because it's kind of behind there, right? It will press against the heart, and then you may feel that sticking sensation, or you may feel a shocking something. Don't take it light. Don't take that for granted, because that might be the signal that is indicating to you that your heart is under distress. You see, get some help. If you have high blood pressure problems, or if you know you're hypertensive or have high blood pressure, you may want to get to a facility or check your blood pressure, because it may be elevated. Okay? If that is not the answer, then you need to get some help as soon as possible. Get to your doctor, get to a clinic, get to ER, and have them examine you to see if there is something happening that is causing the heart to misbehave. Okay? So I'm just using that as an example to say to you men, and even some of you women, don't ignore the symptoms, especially in your chest. If you're asthmatic, then if you pull in deep, you may get some wheezing. You may hear like a sound. Or if there's a bad cold in your lung, when you pull in deep the oxygen, you may hear some wheezing, or you may start coughing, right? One of the things that you can do to relieve the sensation that you feel in your chest, and I like to give solutions as I go along, right? So bear with me. Just cough, do some coughing, do some coughing that can help to relieve, or help to relieve the stress of the heart. And if you do the coughing and it persists, get to the hospital, because you may be on the verge of having something happen, right? And I give this. I spoke with someone today about this not too long ago. I had this friend who I knew that when I saw him, whenever every time I see him, he'd be perspiring profusely, right? He would be sweating a lot, but he's working. So he's taking that because he's working, and he's not working like outside outdoors. He's working indoors. This is very important. I want you to listen to this because it will teach you something. He's working indoors, it's air conditioned, but he's busy. So he's perspiring a lot. And some people do that, and it's normal for them. Overactive sweat glands. And I would see him, and every time I see him, I said, boy, you need to get yourself checked, or come by me after work and let me see you if there's a problem. Because you're not supposed to be sweating like that so easily. He said, man, doc, man, I can come, come, just work, busy. I said, boy, take some time out. Take some time out and look at yourself because every time I see you, you're sweating really profusely, a lot. And I don't think that's normal. He said, all right, I'm going to leave soon. And when I go on leave, I'm going to come. Okay? I said, look, you need to make it urgent, make it priority because it's getting worse. I see you have shortness of breath. You can't fatigue too much. You're sweating a lot. Something is happening in you. You need to get checked out. Okay? Well, he went on leave. And I don't know what his plans were or when he was coming. He said he was coming or he was going to come. But that morning, it was a Monday morning, actually, I remember. A Monday morning, he was taking his child to school. He took the child to school and was on his way back wherever he was going, if it's home or to see a physician or I don't know what he was doing. But all of a sudden, when he got to the crossroads to go left, right, or straight, his feet apparently went down on the accelerator and the car sped up and crashed. Okay, he crashed, I think, into a post. And he died right there in the car at the post. So he lost consciousness right there. And in the beginning, it was felt that the guy had an accident and he died in the accident. He died as a result of the accident. But in my mind, when I heard what happened to him, right away, I said, this man had a heart attack behind the wheel, This guy had cardiac arrest. And it had to happen because he's not a careless driver. And it was early morning. He doesn't consume alcohol like that. And so when I heard it, right away, I said, this man had a heart attack. Well, I didn't know that I suggested that if anyone knows his wife, because I didn't know who his wife was or his family, have him do an autopsy on him because my suspicion is that was cardiac arrest. It wasn't an accident. Good thing there was no car in front of him or so. Or maybe if it was, maybe the person would have come out and it might have been a doctor or something, hopefully. But he died and maybe they did the autopsy, but I learned just today I learned that, they thought it was an accident, but when they found out he had cardiac arrest, he had a heart attack behind the wheel, which I knew that. But you see, the problem there, the point I want to get at is that he procrastinated. He kept saying, and I kept seeing it, and he kept saying that I'm going to come. I'm going to wait until I get on. But listen, when you're sick, when you find that your body is not normal or something is wrong and it's really getting bad, take some time out from the job and get yourself looked at, because when you pass or you die, the job is going to continue. They're going to find somebody else and replace you. Seriously. Okay? Find yourself to a place where you can be looked at, assessed, and hopefully treated, because had he done that, I am certainly would have been here still today, because it would have been diagnosed and he would have been probably, he would have probably had to get a stent or maybe, something to help to allow him to continue living. Don't procrastinate, my friends. He was one who did, and he paid the ultimate price. He didn't make it. Right? He died right in the car. right in the car. They pronounced him dead on the spot. You see, and I know that many times, I am sure that many times when those type of accidents happen, it's not an accident. The accident is the end result of of of, of a condition that created the scenario where you were involved. I saw another incident on the highway. I was just by Maryland driving, I was going south from north to south. I was going north to south, and the truck was coming um, south, south to north, right? So I was passing him, right? And I saw this truck all of a sudden came off the road, right? Came off the road and crashed in the bushes, just collided in the 18 wheeler. Just went. I passed and I saw that, right? So I looked at that and I said, this man didn't get a flat tire. You know, the truck just sped up and he crashed. And when they did the autopsy on that man, they found also that he had a heart attack. He just didn't crash. He died as a result of cardiac arrest in the vehicle, which occurred to him and caused him to crash, and then he died. So I am of the firm belief that many accidents that happen um, from similar type of experiences where persons would have suffered some cardiac arrest or some aneurysm or something behind the wheel, and they just created an accident or caused an accident to happen, either to themselves or to others. My friends, don't wait for anything like that to happen to you. Get yourself checked. And if you don't, many men don't like the doctor. I heard that today twice. Man, doc, I don't really like doctors. I don't like to go to doctors. Get yourself checked out. I say get yourself checked at least twice a year. I always recommend that. In the beginning and the last part of the year before it ends, the last 6 months before the year ends, because you need to know that you're okay. And if something happened to you, at least you know what period it happened in, either the first 6 months or the last 6 months. But if you do it once a year, how are you going to know when it might have started? You wouldn't know. You see? So I always recommend having a total body screening, a total body analysis, a check at least twice a year for your own benefit. I do it almost every month. I screen myself almost every month just to make sure that I didn't pick anything up, because I see people every day almost. And people come with all sorts of things. You don't know what they have until you screen. So I have my mask, I wear it. People say all sorts of things, but I always wear a mask. I carry it with me, and I protect myself until I know you're clear of any bronchial type of activity or illness. And talking about that, did you all know that there's another, I said it already, another virus that's out there that is creating havoc already? And I know it's here in Guyana because many persons are coming down with a virus that they say is the flu virus. It is a flu virus, but it's greater than just the flu. It's one that they call it cicada, right? They say it's a they term it COV2, right? COV2, a COV2 variant. In other words, they want to say it's a coronavirus 2. Remember, the first one was coronavirus 1. Now they probably want to say coronavirus 2 variant. It meaning that it's sprung off, I guess, of that. But this one it's creating some havoc already in parts of the United States. And I know it's here. Because when people didn't think coronavirus was here, I found it long before people know it was announced that it's here. I found it in somebody. And I said, something wrong here, because we haven't heard anything yet about it, but why do you have this? And this person had just flown in from some country and she had symptoms, and when I checked her, I found it. And this was weeks before they announced it here. So I know that it's here. That variant is here. They call it COV2. It's here, and I don't think they know what to do with it as yet. But I'm going to say to you that if you hear someone coughing a lot, or if you're coughing a lot, if you have shortness of breath, and it's not heart related, it might be lung related. Um, if you have any fever that's not going away and it's not dengue or one of those types, you know, if it comes down with chills, fever, maybe coughing, maybe even some headaches if you're getting headaches too, and it's just like the previous one, right? Some persons have symptoms that they feel exhausted, they feel tired and fatigued, and you think it's a low blood situation, but when they get the fever and they start the coughing and the runny nose and everything else, it becomes something that is beyond something normal. So I don't want to alarm anyone, or I don't want to be the first one to break the news or so, but it's out there and it's affecting many parts of the states, many parts. And it's really big in New York, and I'm heading there soon, and I'm kind of concerned, but I'm gonna walk with my immune enhancers, and um, I'm gonna walk in my mask too. I don't ever fly without one, and I'm gonna try to protect myself. But it's hard to protect yourself 100%. It's very hard. It's very difficult to, because you're not gonna wear the mask all the time, and you're gonna expose yourself at some point, and it's something in the air, and you're breathing, right? So it's airborne. It is also airborne, and I'm saying to you, take caution. Get a mask. Don't let nobody fool you. Mask helps. I don't care what anybody say. But you gotta get the right one. You gotta get an N95. Get an N95 mask, and it will protect you from 95% of what is out there, and it's not just for this flu. There are people who have, tuberculosis, they have pneumonia, they have a lot of streptococcus bacteria. It's not just about corona or about the cicada. It's about protecting yourself from even allergens that are in the air. And this is a period of time when it's out there too. So don't let nobody say, oh, there's no coronavirus. We hear that here when we tell people we checking for corona, and guess what? When I check for the corona, many of them have it and don't even know they have it. And it happens every day here. And the same people say, I thought that thing gone already. That thing about still. It never left. You all don't know it never left. It's an influenza virus. It ain't going nowhere. You gotta enhance your immune system. You've got to take your antioxidants. You gotta get your D3 and your vitamin C and your high berry antioxidants that can enhance your immune system and help you to overcome anything that might threaten your immune system. That's your defense. I keep saying that all the time. Even men, and we talking about men's health, that is important. That is important because I saw it today. Guy don't even know he had corona, and he had it bad too. So men's health is not much different than women's health or humans' health. The only factor that men focus on most of the time is their erections and their prostate, and that kind of thing. But listen, that is the least thing that you want to worry about, because if your heart ain't good, then all that ain't gonna matter. You're gonna die doing what you're doing. Seriously, many men have died having intercourse because they're looking after the pelvic region, they're looking after erections, and they forget that it takes blood flow, or they don't know. A lot of men don't know that there's blood that makes the penis becomes erected. It's blood, and if you don't have good blood transport system, then you're going to be in serious jeopardy, because many men die from heart complications because they have blockages in the arteries and vessels, and they have arteriosclerosis, plaque, you know, all over the place. And you focus on that. But that is the least of the concern, because if you're in good health and you have good circulation and you have a heart that's working right, an erection shouldn't be a big deal. Once your testosterone level is up, it shouldn't be a big deal. I don't care what age you have. I don't care if you're 90 years old. I got men in the 90s who, in the 80s, who were like horses. Yeah, because their transport system is working right, and they all you've got to do is help them to, you know, maintain their testosterone levels, you know, and their circulatory system, and they have that on the control. Many of you men have weak or poor circulatory systems, and you can't. What the state of your, if you want to talk about men and erection, and we're not discussing that today in its entirety. If you want to talk about that, and you're not getting a fairly good erection, then it goes beyond that. Your transport system is poor. There's too much plaque in your system. There's too much narrowing of the vessels, and you're asking a pump to work with vessels that are almost closed up. You know, so don't look at that. Look at your health, your overall health first. Focus on what's happening to your overall health. If you're getting fevers a lot, and you're getting headache, and you're coughing, and you're sneezing, and you got kidney troubles, and you got heart troubles, or diabetic situations, or hypertension, focus on those. Try to control those, not with drugs. Try to get your body to control with your dietary changes and restrictions, to control what is happening with your blood pressure and your blood sugar. And you know, you men focus too much on sex. It's not about that. It's yes, it's important. Yes, it's part of you feeling that, that manhood and so on. But many of you are focusing on the cart and forgetting about the horse. If you have a horse and cart situation, right? You have the horse and cart, and you're you're trying to you're trying to you're trying to get the horse to pull the cart. The cart gotta be behind the horse. The cart can't pull the horse. The horse gotta pull the cart. So don't put the cart before the horse. In other words, don't put the erection before the heart. The heart gotta work right. The heart has to be the pump or the engine that gotta send that blood flowing through those vessels. And if you're failing to get what you need to get, then it means that the problem is beyond the heart. It's beyond the heart. So we need to talk about high blood pressure. We need to talk about high blood sugar, or diabetes and hypertension. We need to talk about low blood pressure too, because if you have low blood pressure, guys, the same thing will happen, and it's worse than high blood pressure. You see, a lot of you men out there have a lot of mental issues too, a lot of mental problems. You're worrying about things that you can't control, or you can't do nothing about. Worrying, I tell this to everyone, women too, humans, worrying fixes nothing. Worrying only contributes to other things that can go wrong with you. Stop worrying. Try to find solutions. Instead of worrying, find solutions. Because when you find the solutions and you fix whatever it is that is causing you to worry, then what happens? The stress goes, the stress reduces. As you fix what is worrying you, the stress factor goes down, right? Many of you are stressed out because of finances. Stop spending money stupidly. You're buying cigarettes. And we'll talk about that too at the next, probably the next men's session. You're buying cigarettes. You're buying minutes for your phone. You're gambling, some of you. You're the road corner gambling. You're drinking alcohol or liquor, right? You're out there buying food every day. You're not cooking at home, right? You eat, and your families or your spouses are cooking and you're eating out, right? You think the restaurants and the cook shop cook foods for you and your problems? Unless you can specifically have food catered to your problems. You have high blood pressure and you have diabetes. The average man with high blood pressure have diabetes, or the average man with diabetes have high blood pressure because the linking factors that creates them are pretty similar. Fat. Most of the food that you eat have a lot of fat content. It's high fat content. And the fat is blocking your arteries and vessels. It is blocking up your gallbladder, blocking up your liver, blocking up your pancreas. How you expect to function when you're loading yourself with fat and you're eating too much of the dead, and the dead has a lot of fat on it? You can't want to get anything living out of something that's dead. It don't work. The dead don't have life. If it's really dead, it ain't got no life. It can't give you living organisms. It's dead. The only thing that is living that comes out of dead is worms. Worms. That occurs naturally in the dead. You see, if you have a piece of chicken that looks good and it's dead, well, if it's a piece of chicken, so it's dead, right? And you put it down and leave it there you forget it there for a couple of days. Soon enough, you can start smelling it because it's dead, right? No oxygen going through it, it's dead. No blood flow, no blood supply. And then you just, shucks, boy, you forget this chicken out there 3-4 days now. When you go look at that chicken, guess what you're going to find? Worms. Worms. Worms love the dead. You see? You have oxygen. Just imagine, we have oxygen going through our bodies because we're living. And if you can hear me, then you're living, right? Because you can't hear me if you're dead. And we have worms. And we live in. And we have oxygen going through us. Okay? Can you imagine? We got 6 minutes. Thank you. Got back 6 minutes. Can you imagine something dead? We ain't living, and we got worms in us and parasites. You don't believe me? Let me screen you. And I guarantee you, I'm not going to put nothing there. I can't put nothing when I screen you. I cannot. This is one system that we have here that don't take bribe. I don't believe in that, and I don't practice that. This system don't take bribe. I don't care what you do, you can't bribe it. What we see is what comes out of you. What is in you is what we see. I cannot manipulate it. And I almost guarantee you, I don't remember seeing any human here that's over 5 or 6 years old that I screened that didn't have worms or parasites in them. They're a little different, you know. Worms and parasites are somewhat different. You know? Parasites feed off of you. So does worms. But parasites are a little slicker than worms. But all need to be out of you. All need to be dead because they will destroy you, believe it or not. They'll destroy you. Because they eat, mess, and multiply in you. Man and woman. Eat, mess, multiply. All inside of you. Man, woman, boy, girl. So you want to get rid of them parasites. You don't believe us? Come here and we screen you. We find everything that's wrong with you. Everything. Even if you come here and tell me nothing wrong with you, I'll find what's wrong with you. Can't tell you the secret until you come. We'll find it. So if you have a family member or yourself with a problem, or a friend that they can't find what's wrong with them, don't waste your money. Don't waste your time. Schedule an appointment and bring them here. We'll find what's wrong with them. And they can go back. I'll find what is wrong. There's 3 doctors that work here. We find what is wrong. We will give you a printout of what is wrong, and then you could take it to your physician or whoever you want to take it to. And at least they'll be treating you for what is wrong with you. I am tired of hearing people say they go to the doctor, they screen them, and they take blood work, and they do this, ultrasound, X-ray, MRI, CT, and they can't find what's wrong with them. I'm tired of hearing that. And you telling people, man, it's mental, it's psychological. That's baloney. You can't tell me that a man or a woman got pain, and you tell them nothing is wrong with them. You can't find what is wrong with them. Maybe you can't find what is wrong with them because you don't have the device to help them to find what is wrong with them. But it doesn't mean that nothing is wrong with them. You can say nothing is wrong with you based on what we have to screen you or to find what is wrong with you. We are not finding it. Seek alternative means of finding it. I wish doctors would do that. But don't tell people nothing wrong with you because you're playing with their minds. And I don't care who listening. Could be the health minister, I don't care. There are doctors out there who persons are seeing and they're going to that are telling people that the problems that they have are psychological and the people have pains. You can't think of pain. If you overthink, you might get a pain in your head. But if a person has pain, it means that there's an inflammatory state somewhere. If you can't find it, just tell them, I don't really find what is wrong with you. But it doesn't mean that there's nothing wrong. But I haven't been able to find it. It's okay to say that, doctors and healthcare practitioners, whoever you are. It's okay to say that because none of us are gods. We don't know everything. Some of you behave like gods. And the men come to you, and I had one today. This guy's sick for years, he's having issues. And he's been going. He even went to America. All that he told me. He went to America and they're doing this and they never found what is wrong with him. Today he find everything and he's in shock. I screen him and the guy have a whole host of things wrong with him. I don't know how. I think your parameters are too high. You need to reduce your parameters on the equipment you're using. Because you're misdiagnosing or underdiagnosing or not diagnosing. You know, and don't make me your enemy because I am just here to help. If you want to use us just to find out what is wrong, let people know that they have issues. Allow them to find out what is wrong. I had somebody who said to me that if they take the family member out of the hospital, that they're gonna take them back. If they take them out of the hospital to find what is wrong with them because they can't find what's wrong with them in the hospital, they can't find it. And if they take them out of the hospital, they ain't gonna take them back in. What nonsense is that? You can't find the problem in the patient. The patient is there on oxygen or having to get oxygen. And you can't find what is wrong with them. And you telling them that if you take this person out of the hospital and they go to the institution that can find what is wrong with them, that you're going to take them back. You only licks, man. Where did you learn to be a humanitarian if you are a humanitarian? We have people who are practicing medicine that really shouldn't be if that's what you do. At least give the person the option. We really haven't found it, but listen, if you could find a place where you could get a diagnosis, bring it back, and we are going to help to find what is that. We are going to treat. You can do that. I was trying to help the family, but they were told that if you take the person out of the hospital, you can't bring them back. I don't know if the health ministers passed that law or if the health minister knows of that. Look at the doctors you have at your institutions. If you can't find a diagnosis Let the people have an option to find a diagnosis and bring it back with them, and you look at them and treat them, especially if it's an accurate one. Because our diagnosis is 96% guarantee accurate in the world. It's not no horim, scarum, jiggery poogery. It's guaranteed accurate 96% in the world. Been around over 48 years, equipment we use. I don't understand the mentality of some of the people who practice. Like they're gods. We can't find it, so nobody else can find it. Really? In this era? Let me tell you, AI will find what you can't find. This is the era of AI. You hear me? And the AI will find it because the AI is perfect. He's not human or she's not human. Anyhow, believe it or not, the time is up, right? So what we're gonna do, we're gonna continue this men's topic on the next week, and I want to thank you for participating. Um, love you guys. Don't take nothing for granted with your body. Get yourself some help. Call us. Make an appointment. Come in. Let us try to help you to find what is happening with your body and put you on a path where you can recover from your diseases. Please. We're going to continue men's health next week. I promise you that. Next week, yeah, I will still be here. Yeah. I want to thank you for looking. Like, subscribe, because we're trying to get people to look and learn. Okay, so tell your friends and your relatives and the people who you know are sick that they can tune in and they can call. You can call, you can call with your health problems and I will answer and try to help you. Don't be afraid to do it. Okay. Anyway, thank my operator in Channel 2 for participating and helping me to get the words over to you. And I want to thank you. May you have a wonderful weekend. If your birthday is today, from Dr. Haynes and staff and family, happy birthday to you. God bless you. So long. Thank you guys at the studio. Good night.